And also you can stretch out the calf here by just pushing down on the foot slightly. Okay? So this will stretch gastrocnemius soleus slightly in this position. That's number one. And then number two is where we had rotating technique. So here we're rotating. You get a leg up on the table like so. But then we're going to stretch by pressing down either right at the top of the glute or slightly on the low back. You have position here or position here, whichever one you
So
prefer.
are you resting his knee on your leg then?
Yep. For the beginning. And then see when I do the stretch, see I want to lean my body weight forward here, like so. Instead of just being like here and trying to lift with my arm and muscle it, it'll be really difficult. So here I just get a lot more leverage in place.
Is that okay with his hip?
Yeah, I asked him. He
It
said
is?
that's fine. Like so. So you just lean forward like this. Press down at the same time. So those are for the leg. Then I might as well demo here. There's not a whole lot for the upper body either in the prone position. So is it okay if I pull up your shirt? Okay. And we saw part of this in the prone TuiNa routine. This is just a stretch for the low back. The important thing is you get your palms down first. You use palms or forearms. So palms down first. You have to have applied body weight before you stretch. If you don't, then you won't get any sort of stretch at all. One hand's just right around the SI joints, L5 sacrum. The other hand's around L1, L2. So you press down and then stretch apart. So you can do in the middle. You go a little lateral. Same thing, press down. Stretch apart. And this will take a little muscle force if you're using palms. And then you can do the opposite side. Or you could walk around to do this one. The opposite side. And then with forearms, you want to make sure that you have your fingers interlaced so it works as a hinge. Same thing. You want to use the fleshy part, forearm, or more of the fleshy part. So body weight down, and then you stretch apart. Here, you can do over the center. You can go more lateral on his right side.
Is that good for the QL?
Yep.
Okay.
QL, low back in general. And then here. Like so. So that's working into the low back. And then another way you can stretch out the low back here is you do, usually I do the from the opposite side of the table, makes more sense. So one hand, your inferior hand, is going to come around underneath the anterior iliac crest, like so. The other hand, you can have a couple different places along the back, depending on what you want to do. So the stretch is like this. So you're stretching out the low back, it's a good front back kind of stretch. So one hand's here, other hand's here. See? Like so.
What's a low back stretch?
If I get lower, yeah, with this palm. Depending on where you put this palm, you'll stretch out different things. You'll get part of the anterior too. But if I press here, I will get part of this QL as well. And then if I do this, usually I just work up along the spine. With one hand along the spine. Like so. Right about to here. Do the other side. See over here. Like this. So you find the anterior superior iliac crest, one palm's here. Motions like this, using your body weight, you're not lifting and then pushing, you're turning at the waist. Right here.
Elvis.
Yeah, right. So. I'd say this is kind of like anterior, posterior, depending on where your palms are. Because they'll feel this in the front a little too. Okay. And then last is stretching the shoulder in this position. So here's what you do. You squat. You take your superior forearm, you brace it underneath the clients, place your hand on the table, push here to start to get some traction. Then you lean back.
That's for the shoulder.
Uh-huh. Yep, you'll feel this in the shoulder and up into the neck.
No,
Okay.
going to do this golf thing tomorrow. Some of these that we're learning, the opening the elbow,
Mhm.
this one would be nice to put a little stretch.
Oh,
in
yeah.
like that.
Yeah, just depending on, you know, if it's chair or table massage.
Can you, well, go ahead, I don't want to get.
I mean, you could, you know, sitting in a chair, it would be a different position.
Yeah.
You could make it work.
Yeah,
For my tendonitis and physical therapy, they put a strap around my forearm and did the same motion that you're doing, but, I mean,
Yeah, just with the band, apply the pressure. Yep.
yeah.
okay.
So let's make a group and we'll go over those and we'll